Your Health Matters, brought to you by Augusta Health.
My name is Sandy, and in the fall of 2009, I was diagnosed with breast cancer. I met Meg during my second biopsy. She's the breast navigator for Augusta Health.
What I do as a breast navigator is I help women and men and their families actually navigate through the system, either from the point of they're going through the diagnostic process or once they've been diagnosed with breast cancer. I am kind of a personal support system for them, and I help guide them through the system through their surgery, chemotherapy if they need it, radiation therapy if they need it, from treatment through survivorship and beyond. Typically, when you first get that diagnosis, people are in shock. There's a lot of information that's given in a short period of time. One of the things that I do is I go to the surgeon's offices and I'll take notes and give the patient the notes. It's very nice because then they can actively listen to the conversation, and then, they've got notes at home when somebody calls and says, well, what did they say about this, or what did they say about that?
The support of someone in the medical field who knew the ins and outs, who understood the language, who had firsthand experience was just incredible. It's huge to have someone not only guiding the course of your care and helping you make informed decisions about your treatment, but someone who understands what you're going through and understands what you're feeling both physically and emotionally, and is able to offer advice and support.
A lot of times it's reinforcing questions that they've had. They've gone to the surgeons or they've gone to the medical oncologist and they've gotten, or the radiation oncologist, and they've gotten information and they're trying to figure it out, so they'll call and say, did I understand that right? I thought that they said X and Y.
As far as the support that she offered to my husband, John, I wish he could tell you for himself, because she spoke to us a lot about the impact that the disease has on the caregiver. And looking back, I believe his job was probably harder than mine.
Men are fixers, and they can't fix, they can't fix this person that they love. So, a lot of times it is, especially the day of surgery, that's a really long day for family members. So I try to come up and touch base and, just see how they're doing, make sure that, they don't have any problems with anything. Sometimes the surgeons will call me and I'll come out and talk to them about and update them as to how the progress of the surgery is, because it's just a really, really long day. We develop very close relationships with patients. I have some patients that I touch base with once a week. When patients are going through chemotherapy, a lot of times I try to get to them to at least say hi to them once a week if they're coming here for labs to be checked, or I try to make it to their chemotherapy appointments just to touch base. I'm kind of sometimes the anchor that really binds them through the entire system. So when they go from their surgeons to the medical oncologist to the radiation oncologist, I'm a familiar face that's there.
We sat after that biopsy for probably an hour and just talked and cried, and that was the beginning of what I think was a beautiful relationship. Meg quickly became not only part of my treatment team, but she became a good friend to me.
Augusta Health, nationally recognized quality, community-focused care.